Hi, I'm Dirk, back here after a long hiatus on Religion for the Rest of Us. It has been quite a long time since I've done anything with this channel, and what I'm going to talk about today isn't strictly about religion, aside from the fact that most of the people who are about to take healthcare for millions of Americans claim to follow a religion whose founder is known for giving free healthcare to the poor. But I did just get back from my doctor, and I thought it was important to tell this story. I will touch briefly at the end about how our religious attitudes impact how we view healthcare, but for the most part, this is just a story about healthcare in America. And the story that I have to tell is one that I haven't heard anywhere else, although I'm sure I'm not the only one who's had an experience like the one I'm about to describe. I was denied healthcare because of a pre-existing condition that I didn't have. And in fact, I never had. And in spite of being perfectly healthy, there was no insurance company that would cover me. If the Affordable Care Act or Obamacare is repealed and replaced by one of these Republican bills currently under consideration by Congress, we go back to a system where what happened to me could happen to anyone. So this is what happened. A little over 10 years ago, I found a lump in my neck, and it was about the size of a golf ball, right here. I had no idea what it was. So I made an appointment to see my doctor. Now, I wasn't sick, and I had no other symptoms. No pain, nothing. Just a lump in my neck. I went in to see my doctor, and he examined the lump. He felt it, and he says, "I don't want to alarm you, but I think you might have lymphoma," which is, of course, alarming. So I say to him, isn't that cancer? He says, "Yes, but it's the really curable kind of cancer." So I say, "Okay, what do we do next?" And he says, "I need you to see an ENT, an ear, nose, and throat doctor, right away. Today if possible, tomorrow at the latest." And up until this point in my life, in my late 20s, I'd never gotten a doctor's appointment this quickly. I'd been to the emergency room a few times, but I'd never seen any kind of specialist that fast. But I guess when they think you've got cancer, they just drop everything. So I go and I see this ENT that afternoon, and right away he says, "I want you to get a CAT scan right now, and then tomorrow morning, I want you to go get an MRI, and then come back in to see me immediately afterwards." Now, if you're hearing this and you're thinking, well, this all sounds really expensive, you're right. Now, at the time, I was working as a teacher in Philadelphia and had great health coverage through my job. But if I'd been paying out of pocket, these tests would have set me back several thousand dollars. Several thousand dollars that I didn't have at the time. But since I knew that I had great health coverage, I wasn't worried about it, and I just got the tests that they told me that I needed. Now, after getting the CAT scan and the MRI, the next morning, I went back and I saw the ENT to get the results. And he tells me that now he's almost positive that I don't have cancer. He shows me the image of the lump, and it's this perfectly smooth oval shape. He says that if it was cancer, it would be more like a blob with cells growing every which way. And since it wasn't like that, he said what I had was probably an embryonic cyst that somehow got irritated and inflamed and had ballooned up. He explained to me that an embryonic cyst was just like a little extra flesh that grew in my neck when I was in utero. It didn't really do anything or cause any problems, but for some reason it had blown up to the size of a golf ball, but he wasn't worried about it. He said that he still wanted me to go in for surgery and have it biopsied so they could send it off to a lab and determine conclusively that it was not, in fact, cancerous, but given the images from the CAT scan and the MRI, he didn't feel like we needed to rush. So he scheduled my surgery for 6 weeks out. Well, 6 weeks later, this thing had just disappeared on its own. Now, I still went in for the surgery, and I got prepped. I'm in the gown, and the surgeon comes out to introduce himself and examine me before the procedure. And he takes a look at me and he says, "I can't see what I'm supposed to biopsy here, and I'm not just going to cut you open and start digging around for something I can't see." So he sends me home, which was certainly probably the right call to make. And at this point, I didn't think anything of it. Nobody seemed to think I had cancer. None of my doctors did anyway. I felt perfectly healthy, and my doctors weren't at all concerned about my health. It was just a false alarm. And I figured that was the end of it. Until 2 years later, when I tried to buy health insurance on the individual market. This was in 2008, before Obamacare had passed, before he was even inaugurated. I had quit my job teaching, and I'd taken a job at a small tech company in San Francisco. And as is sometimes the case with smaller tech companies, They originally brought me on as an independent contractor, so I wasn't getting any benefits, just straight cash payment for my work. Now, when I accepted the position, I figured I was young and healthy and would have no problem buying basic health insurance at relatively low cost. But the first plan I applied to rejected my application. They didn't even offer me like a high cost plan that I couldn't afford. They just said, we can't cover you. It didn't make any sense. So I applied to other plans and every single one turned me down. And I couldn't make any sense of it until I started digging. And it turns out that since I had had this cancer scare and this lump went away entirely on its own and never came back, because this thing was never biopsied and sent to a lab to be conclusively determined to be non-cancerous, as far as every insurance company was concerned, I had cancer. I had a pre-existing condition that made me uninsurable. None of them would cover me. And this does bring me back to another religious connection to this story and the current move to repeal the Affordable Care Act. I think we need to ask ourselves, what do we really believe? Not only about healthcare and whether or not healthcare is a human right that should be available to everyone, or if it's something that can be denied based on whether or not you have the misfortune of becoming sick. But I also think we need to ask ourselves, what do we believe about illness? And to what extent do we believe that people who get sick somehow deserve it? I think most of us recoil at this idea, and we probably should. No one wants to think that a child with cancer deserves to die of cancer. And yet, if we subscribe to a theology where God controls everything that happens with absolute authority, then we have to accept that God gives kids cancer. And furthermore, if we're going to assert that God is also just, then we have to conclude that God gives kids cancer because they deserve it. Now, it's not like there aren't voices on the right in this country who are expressing attitudes that line up with this underlying belief. For example, Representative Dr. Roger Marshall from the 1st Congressional District in Kansas said, just like Jesus said, the poor will always be with you. There is a group of people that just don't want health care and aren't going to take care of themselves. Just like homeless people, I think just morally, spiritually, socially, some people just don't want health care. He said the Medicaid population, which is on a free credit card, as a group do probably the least preventative medicine and taking care of themselves and eating healthy and exercising. And I'm not judging, I'm just saying. Socially, that's where they are. So there's a group of people that even with unlimited access to health care are only going to use the emergency room when their arm is chopped off or when their pneumonia is so bad they get brought into the ER. Okay, so aside from completely missing the point Jesus was making when he said the poor you will always have with you, Representative Marshall is clearly both judging and blaming people who are sick for their illness. And we hear a similar line of thinking from Mo Brooks from Alabama's 5th District. When he said of the new legislation, it will allow insurance companies to require people who have higher healthcare costs to contribute more to the insurance pool. That helps offset all of these costs, thereby reducing the cost to those who lead good lives. They're healthy. They've done the things to keep their bodies healthy. And right now, those are the people who have done things the right way that are seeing their costs skyrocketing. Again, suggesting that if you're sick, it's because you deserve it. Now, I'm going to highlight here what should be the obvious irony of my own situation. If I had been irresponsible and ignored the lump in my neck and just let it go away all on its own, I would not have been denied health care. I could have bought health insurance. But this idea that illness is somehow entirely the result of poor moral choices, it's not only theologically and ethically problematic, it's scientifically indefensible as well. And it completely ignores the fact that unless we die tragically before our time, all of us will someday grow old and die. And that is not a moral failure. That's just what life is like. I mean, there's a lot here, and there's much more that I would like to say about it, but I think for now, I just want to encourage everyone to contact your representatives, because if this thing passes into law, anyone could end up in a situation like mine, where in spite of being perfectly healthy, you could be denied health care. Now, you can find links to contact your representatives, your members of Congress in the notes below. And although I've not posted anything here for a couple of years, I have a feeling there will be more to come, so please like, share, and subscribe. And again, thank you for watching Religion for the Rest of Us.